Good afternoon, everyone. Thank you. Welcome to Wake Forest University for the speakers. Welcome to the second part of the Race and Equality and Policy Initiatives Environmental Justice Speaker Series. I am Bettina Wilkinson, Professor Wilkinson. I'm Associate Professor, Associate Chair of the Politics and International Affairs Department here at Wake Forest University, as well as the Director of the Race and Equality and Policy Initiative here on campus. And I'm pleased to welcome you to this second event of a two-part series that we have on environmental injustices. So the fall event that we had a few months ago raised awareness just of environmental injustices that take place here in North Carolina, and the focus of this event is looking at the effects of North Carolina environmental injustices. Please note that this event would not have been made possible without the support of the Center for Energy, Environment, and Sustainability, without the support of the Environmental Program, American Ethnic Studies, the Office of Civic and Community Engagement, the Office of the Dean of the College, along with the Politics Department. This event is being recorded, and the recording will be available on the RIPI website, ripi.wsbu.edu, in the next few days. Following this event, we will have a reception outside with some light refreshments, and you are welcome to peruse and see the student poster presentations from Dr. Romy Kirby-Straker's class, along with my students' presentation. Before introducing you to our event speakers, I wanted to bring attention to the gravity of today's topics by actually informing you of a phone call that I had of someone who was interested in attending this event but was not able to do so. So this was a phone call that I had of a resident of Wilkes County who lives in a predominantly Black community at the bottom of a cattle feeding lot. Given the location of her neighborhood, she's regularly exposed to polluted water caused by a runoff that comes from the cattle feeding lot. The runoff is contaminated with cattle feces and E. coli, among many things. She mentioned that where she lives, there is definitely a little boy network with leaders going through the motions, declaring their commitment to citizen safety and well-being, but not addressing their concerns comprehensively. With increasing exposure to polluted water and rising cases of cancer, E. coli, liver problems, strokes, and many things. The data that is being collected is not comprehensive, the reports are not thorough, and the regulation that exists, she would say, is not enough. There's a lack of will to address citizens' concerns to the point where she feels like in this state, fish and aquatic life are oftentimes valued more than human beings. With that, I will present to you the speakers for this event. So we have four fantastic speakers. Our first speaker of this roundtable will be Ms. Carrie Wiggins. Ms. Wiggins is the Boards and Commissions Director for the North Carolina League of Conservation Voters Foundation. She brings to the table more than a decade of experience working with community-based organizations, building equity and access to education, especially for children attending Title I schools. Carrie has worked with several nonprofit organizations, including the YMCA of Northwest North Carolina and Goodwill Industries. As a prior educator with the Winston-Salem Forsyth County Schools as parental involvement coordinator, she understands the importance of creating equity in education for the advancement of all children, especially children of color. Prior to joining the North Carolina League of Conservation Voters, Carrie worked as a patient advocate for a behavioral health hospital. She has an MS in Human Services from Capella University, a BS in Sociology from the Winston-Salem State University, an associate's degree in human services from Forsyth Technical Community College. Carrie is a veteran of the United States Army National Guard as well. Today's second speaker is Dr. Stephen Sills. Stephen Sills is the Vice President for Research, Policy and Impact Center. He's a well-regarded researcher in the fields of housing and policy, economic development, public health, and behavioral health. He has extensive experience as a principal investigator, co-principal investigator, evaluator, and methodological consultant, having been involved in over 100 applied and community-based projects. He uses a mixed method approach to study in engaged community. In recognition of his work, Dr. Sills has been selected as a policy scholar with the Pluribus Unum Fund and as a fellow with the Robert Wood Johnson Interdisciplinary Research Leaders Program. He's also a sought-after consultant working with organizations including the United Way of Greater Greensboro, Community Foundation of Greater Greensboro, East Greensboro Now, and the Hinton Rural Life Center. Our third speaker today is Mr. Edgar Miller. Edgar Miller became executive director of the Winston-Salem-based Yadkin Riverkeeper in October 2018 and became the Riverkeeper executive director on July 1st, 2021. Yadkin Riverkeeper's mission is to protect and enhance the Yadkin River, its lakes and tributaries through education, advocacy, and action. Prior to working with Yadkin Riverkeeper, Miller served as the Director of Government Relations for the Conservation Trust for North Carolina for 17 years. As a registered lobbyist, he represented the North Carolina Land Trust before the North Carolina General Assembly and U.S. Congress, advocating for increased conservation funding as well as tax incentives. He also represented the State's Land Trust on the North Carolina Agricultural Development and Farmland Preservation Trust Fund from 2006 to 2018 and served on the statewide North Carolina Local Foods Advisory Council. Miller was the Director of Policy for the National Recycling Coalition and worked as a lobbyist for the U.S. Congress for the American Steel and Iron Institute, both in Washington, D.C., before moving to his home in Lexington, North Carolina. He is a former president of the Tourism Recreation Investment Partnership. TRIP is a local nonprofit that supports the development of tourism and recreation assets in Davidson, North Carolina. He has worked with the Yadkin River Park and Daniel Boone Heritage Canoe Trail on the Yadkin River. He has worked along with the Advocates Creek Watershed in Central Davidson community, along with his wife, Kibi, and teenage daughter, Gianna. I apologize if I'm confused for that. Whose older sister, Avalon, is a freshman engineering student at NC State University. Miller holds a BA in botany from Duke University and a master's of environmental management from Duke's Nicholas School of the Environment. And last but not least, our last speaker will be Crystal Dixon, who is an assistant professor of practice in the Department of Health and Exercise Science here at Wake Forest University. Dixon received her undergraduate degree from East Carolina University and her graduate degrees in public health and sustainability from Wake Forest University and ECU. Dixon currently teaches courses related to health and has taught a course with Dr. of Medicine Harris entitled Race, Sustainability, and Environmental Justice. Dixon's research explores the intersection of environmental racism, sustainability, and public health. She has contributed to research funded by the National Institutes of Health, National Aeronautics and Space Administration, aka NASA, the Center for Energy, Environment, and Sustainability, and has co-authored several studies. She has presented her research contributions in several venues, including those of the American Public Health Association, the Food and Drug Administration, and has been featured on national podcasts, including blackdoctors.org. Dixon's current research is exploring the intersection of disaster resilience, climate change, and public health in the Caribbean. Concurrently, Dixon is consulting on a NASA-funded research project that is exploring the use of green infrastructural solutions to address flooding disproportionately impacting low-income communities in North Carolina. As a governing counselor for the environment section of APHA, Dixon contributed to passing the first policy brief calling for the assessment and oversight of healthcare waste as an environmental justice concern. Dixon currently serves on the Clean Air North Carolina Board of Directors and the Partnership Project. With all of that introduction, now I turn to our first speaker, Ms. Carrie Wiggins, who will lead us with her conversation presentation.
Well, good afternoon, and it is a pleasure to be here. And I think I'm going to start off with how Dr. Wilkinson reference to the call that she had, discussing the inequities in certain parts of the state of North Carolina. Looking at how the eastern part of North Carolina, that's where my thoughts first went when she was sharing that conversation that she had, which will go to support the work that North Carolina Legal Conservation Voters Foundation is doing here in the state of North Carolina. Looking at how we combat these inequities and the effect that they are having on our community and on residents is astonishing, right? So we look at how parts of North Carolina, let's look at the eastern part, let's look at Fayetteville. And that's what another part of my mind went when she was stating it, because in Fayetteville, parts of the community homes are eroding due to flooding for those residents. So the homes are sustaining structural damage that the residents are having to compensate for themselves, because the city is stating that, city government is stating that their hands are tied and there's nothing that they can do. And so each time it rains and floods, that's what these residents are impacted with. So the North Carolina Legal Conservation Holdings Foundation is working to combat that in several different ways. So I am on the C3 side of this organization, which is the organizing component for our organization. And I think it is really critical to the work that all of these individuals are here with me on the panel are doing. So for over 50 years, NCLCB has been working to address these issues. Addressing these issues by working with lobbyists, working with our elected officials. And it is really important that when we look at those individuals that are representing us and that are going forth to represent those communities, right? We have to make sure that we are still sending those individuals that are going to be able to represent all. So we look at the C3 side, focusing on minorities, people of color, members of LGBT, empowering those communities so that their voices and their concerns can be heard. In 1996, Carrie Clark, who's our current executive director, looked at ways of addressing that. So again, we work with lobbyists, we work with politicians, we work with local governments. But what we did not have at the table were those residents themselves. And how can you make that change if you do not empower the individuals that are being impacted by environmental justice or the inequities of the injustices that are taking place in those communities? So Carrie Clark thought, well, how can we do that? So looking at putting in place Power Up North Carolina, Power Vote North Carolina, and then boards and commissions. These three components together represent the Signature 3C programs. They're all very important and they're all innovative in these communities because, again, you have to empower individuals in those communities if some resolve is to be made. People want to be heard, people want to be engaged, but they oftentimes don't know how. So when you are up against big government and it's just little you, what do? You sit back because you don't know how. It's not that you don't want to, but again, you don't know how. That's where Power Up NC comes in. It supports residents. It empowers them. It educates them. It gives them the support and the voice to make changes or to address the changes they want to see in their community. They're trying to be the change that they want to see in this world. When you are living in a community and someone tells you that you are totally responsible for the repairs, the damage caused by environmental justice or injustice, what do? If you are a disenfranchised Black or brown individual, or if you are a member of LGBT, or if you have lived in an underrepresented community, it is difficult to make those changes. So Power Up works with those individuals in the community, educating them, giving them voice, giving them power to make those changes. Because when you know better, you can do better. And that's what they do. We currently work in Winston-Salem, Fayetteville, and Raleigh-Durham area. We also work with individuals in those communities, helping them with gardening, growing their own fruits and vegetables, right? That's how you gain again empowerment. We work in Raleigh-Durham. Those individuals in Raleigh-Durham work with the Power Up team. They oftentimes attend public meetings. They go up against Duke down in Raleigh because they need lower power bills. When we talk about EVs, if you live in one of these communities, how do you operate an EV? If your home is not weatherized, how do you do that? How do you go about having your home weatherized? What is that process? But again, if you are low to medium income and your home is surrounded by trees and you need a new roof, because you may want to look at getting an EV or you may want to get solar panels, how do you do that? How do you keep up with the rest of society? That is where, again, these individuals help empower those disenfranchised. Here in Winston-Salem, Power Up operates to help support communities who have concerns that are leaving them again behind, lagging behind other communities. If you are a senior and you need services and you don't know how, you don't have anyone to help you advocate for those, how do you get those? These are some of the ways that we're working to help remove or change some of the disparities that community residents are facing. Then we have power to vote. Again, I said we need to look at who we're sitting to office to represent us. We have a lobbyist that's here with us that can attest to what I'm saying.
Recovering lobbyists.
I think they're all trying to now. But
I want to get back in your ring.
and we need to, because we need individuals who are going to be on the team, on the winning team. And that is empowering individuals. And when you're on that team, it is often difficult. But we have to stay strong, we have to stay united, and we have to help individuals to understand that your vote is your voice. You either cast a vote one way or you cast a vote another. But this is how we are working to do that. Engaging these individuals at city council meetings, helping them to preparing them to sit in front of elected officials in Raleigh to help promote and make change in their communities. That's what that is all about. When you look at the eastern part of North Carolina, which is what I stayed in my mind went to, when we still have pig farms that are operating there and residents are having slough all over their homes, and we're living in 2023, and this is what is still happening to residents in those areas. We're looking at when there's rainfall, torrential rainfalls, and they're flooded, and individuals are still trying to recover. Those are environmental justices or injustices that are impacting those residents. And once they try to recover from one disaster, there's another disaster, but yet we're not there, and they don't have the power, they don't have the force to make those changes. That is what we do with Power to Vote. Then we have boards and commissions, which is one of the new kids on the block. So we looked at social issues, we looked at democracy. But how do we gain power? How do we gain our voice? We gain our voice by engaging with our younger community, right? Serving on public boards or commissions at the state or local level. If you're 18 and registered to vote, and you're engaged, guess what? That's a platform for you to be able to get involved and to use your voice so that we can make the changes that they are working at the upper level to implement. At this level, those are the ones that we're working to help change. So becoming a part of boards and commissions give you a voice at the table. It also gives you a voice. It gives you an opportunity to make change in those communities. It gives you an opportunity to advance someone else and to empower them by giving them voice. We look to engage those individuals because guess what? One day you may decide that you may want to run for public office. That's a thoroughfare through there. Because you've been involved and engaged in environmental justice at this level, it gives you an opportunity, puts you in a position to be at the table to make change for those who cannot make change for themselves. That is the work that NCLCB is doing to address the inequities in our community as a result of environmental justice. Thank you.
Now we have a presentation by Stephen Simmons. We'll have a presentation
So I'm going to be talking from a sociological lens about health equity in particular. So rather than referencing environmental justice issues, I'll be looking at social and economic justice issues and how it shapes the outcomes of health in the Dan River region. The Dan River region includes the city of Danville, Pennsylvania County, Virginia, and Caswell County, North Carolina, in this particular project. Now, you'll see lots of references to UNC Greensboro. I was, until last year, a full professor of sociology and director of the Center for Housing and Community Studies, where this research project originated. I'm now at the National Institute of Minority Economic Development, based out of Durham, offices in Raleigh, Charlotte, and new one at Bennett College campus in Greensboro, historically Black Women's College, and also at VCU in Richmond. We focus on ameliorating the issues that were just spoken about by empowering individuals around economic activity, small business development, loans to communities, development of affordable housing, and other solutions to these social issues. I focus also on the politics and work with lobbyists at the State House, targeting specific bills that impact minority health, educational opportunity, economic development, and housing affordability. So the Center for Housing and Community Studies at UNC Greensboro conducted this health equity assessment for the Dan River region in collaboration with the Dan River Area Health Collaborative. The assessment aimed to identify health outcomes, health outcome inequalities, determine priorities and improvements, and resource allocation for the region. The process involved community engagement, very importantly, starting with people, data collection, resident input, and focusing on social determinants of health like economic stability, education, employment, housing, nutrition, and overall well-being. You see here a list of a few of the organizations involved. We were charged with updating the data from a 2017 health equity report, again, by engaging the residents and collecting both primary and secondary data from various sources. The population in this region is diverse. 36.5% are non-white residents in dispersed pockets across the area. The health equity assessment process provided an opportunity to build support among stakeholders, engage with residents and social service agencies, and identify barriers faced by communities in accessing primary healthcare services and addressing social determinants. Some of our key data sources are here. The report aimed at examining access to quality healthcare and health disparities in the region. Data was collected through interviews, focus groups, surveys, secondary data sources, with findings intended to raise awareness and develop recommendations for improving health equity. I'll note that all of this was in the midst of the 2021 pandemic. We had to learn a lot on how to do a focus group through Zoom in a rural area without broadband access, how to gather people in a safe and comfortable manner in a parking lot of a church to be able to talk about health issues. So there was a lot of methodological flexibility employed in our data collection. I'll focus for this talk, this is from a 60-minute talk, so I'll focus for this talk on neighborhood and built environment primarily, and then on rurality itself as a social determinant. The area is home to 125,000 residents and grapples with challenges such as poverty, economic disparities, and limited educational opportunities. Community amenities and resources such as parks and recreation programs represent some of the region's strongest assets. Many residents praise the facilities and programs offered by their parks and recreation and other government entities. However, not everyone has equal access to these resources, leading to concerns about equity and health. Access to facilities and programs depends on an individual's neighborhood, with some areas enjoying better amenities than others. Our focus group participants observed that parks near low-income areas were often neglected. Respondents to our survey rated their community in 7 domains: exercise and recreation assets, social connections, food and healthy eating, housing, safety, community resources, and finally, COVID-19 impact on their community. This was using a standard 5-point Likert type scale. The responses were grouped into negative, neutral, or positive attitudes. In community resources here shown, more than half acknowledged good fire and police protection, but agreement declined for other statements such as quality public schools, after-school programs, and neighborhood watch programs. The report also highlighted the significant influence of community amenities and resources on health outcomes in the Dan River region. Key issues included food access, with 33% of residents living in food deserts, where there's limited availability of grocery stores offering healthy food options. Access to food resources remain a challenge, both in the city and in the county for residents. They describe their neighborhoods as having food deserts. Additionally, the prevalence of dollar stores selling low nutrition foods exacerbates the problem. I don't know if you've driven through rural North Carolina, but the only place to shop is a Dollar General, a dollar store of some kind. It does not qualify as a nutritious food resource. Economic security in the area. The Dan River region faces poverty and economic disparities, with household median incomes 30 to 35% lower than the state averages of Virginia and North Carolina, respectively. This income inequality affects access to healthcare and is a strong predictor of life expectancy. Education is linked to income, and as we already pointed out, many people ranked their schools lower in their neighborhoods. 18% of the population lacks high school education, and only 33.6% of survey respondents believe that the area has good quality public schools. The social context of poverty contributes to worsening health outcomes, as it weakens social cohesion and institutions. Poverty affects every aspect of a person's life, as you see here quoted from one of the respondents. From decision-making to living conditions, families often face difficult choices between essentials like food and other necessities. Consequently, people often struggle to meet basic healthcare needs. Structural impediments, however, in the Dan River region include transportation, housing, and community safety. The region is vehicle dependent, with limited access to public transportation, sidewalks, or greenways. Homes with no vehicles range from 6% in Pennsylvania County to 16% in some neighborhoods in Danville, following patterns of racial distribution of non-white residents. With half of disposable income going towards transportation and housing costs, limited public transportation options significantly impact access to healthcare, social services, education, employment, and recreation. About 16.8% of our survey respondents reported unreliable transportation for medical appointments or prescriptions. Transportation emerged throughout our interviews, our focus groups, our surveys as the most critical social determinant of health in the Dan River region, significantly affecting access to care, services, education, employment, etc. The lack of transportation options exacerbates the challenges faced by low-income families, resulting in missed appointments and limited access to medication. Approximately 18% of homeowners in the area are also cost burdened in their housing costs. 40% of renters, on the other hand, are cost burdened. This means they spend 30% or more of their income on housing and housing-related expenses. 23.4% of our survey respondents said they can't afford rent or mortgages in their area. The region faces high demand for housing, rising costs, substandard conditions, and issues like eviction, homelessness, and health problems related to housing conditions. Substandard housing in particular has been linked to physical and mental health concerns, especially among children. I'll point out that with the new casino being built, this problem will get much worse in the coming months and years. Substandard housing, such substandard housing conditions such as mold and disrepair negatively affect residents' health. Public housing and housing choice vouchers have not adequately addressed this issue, with long waiting lists and insufficient reputable landlords accepting vouchers. Homelessness, which has a unique challenge in rural areas, is a consequence of the housing crisis, further exacerbating poor mental health and physical health outcomes. Homelessness in rural areas is often invisible, as people tend to shack up and stack up, living with family members in multi-generational households. Affordable housing and housing conditions also received a large number of negative responses in our community-wide surveys. 2/5 of respondents said that there are no affordable housing options for people making minimum wage. At least 1/3 thought that there wasn't enough housing and condition for people to find a decent, safe place to live. So let's talk about reality itself as a fundamental cause of health disparities, contributing to health inequality as significantly as income does. With fewer healthcare professionals available and issues such as social isolation, limited access to resources, rural residents face unique challenges. In this rural area, people are widely spread out. Population density is very small. In this rural area, people are widely spread out, making it difficult for them to access care, grocery stores, and other necessities. The lack of opportunities in the outer reaches of the county further exacerbate this issue. The report highlights the need for improving health equity by addressing these rural challenges in the region. The isolation experienced by residents in rural areas can lead to a sense of being on their own, with people living further apart from each other and more dependent only on themselves or family members. Residents in these areas are often hesitant to reach out or accept help, making it more difficult to address health issues. We computed a health equity score across the geography of the Dan River region. This allows us to compare census tracts to each other within a given area. Color coding is fairly logical, green being good, red being negative. We see that the concentration of negative scores are in the eastern part of Danville, an area that was primarily minority residents. The health equity score itself was computed from 92 variables for each of the 38 census tracts, adding those together as a summative index, and then measuring either the positive or negative correlation with life expectancy. Factors included socioeconomic status, preventative healthcare measures, disease, chronic disease, well-being, crime, and safety. The report goes on for 400 pages, so I won't, but I'll point out that we focused in on 5 key issues and suggested actions for the area: addressing racial disparities in healthcare, addressing poverty as the root cause of disparities, improving housing quality, availability, and cost, transportation access throughout the region, and finally, promoting insurance and health systems linkages. The Dan River region faces challenges in promoting health equity due to its diverse geography, multiple governing entities, differing systems of care. Community stakeholders emphasize the need to address systemic issues like poverty and racism, and recommended engaging in honest conversations with and about marginalized communities. Balancing the rural and the urban communities is essential to correcting these issues, requiring collaboration with various leaders and stakeholders to develop action plans. I'll make sure to circulate later. There's a link to the 462-page report, lots of beautiful maps in there. Infographics that are much easier to read, interactive in nature, are easy to communicate to a broader audience. and an interactive story map or website where you can actually manipulate the maps themselves, clicking on different areas and getting data around them. I'll make sure that those links go out. Thank you.
We learned about the vulnerable situation from it, we're using the Van River region, which includes significant parts of North Carolina. And Virginia, we will turn to a presentation by the Unearthing River.
Thank you, Bettina. Can y'all hear me? Yeah, I usually am the guy with all the maps, but Stephen took those all today. I do have one map, and that's an important map that we'll talk about in just a minute. Thank you. Happy to be here to participate, and I know we've worked with several folks in the room on a variety of different water quality topics, and Professor Smith's class out on the river canoeing. So it's good to be here at Wake Forest. I see my old friend Jimmy Broughton, who we used to lobby together. He's still lobbying, so he hasn't quite recovered yet. But and so I want to give you just a little bit of background on the Yadkin River Keeper, what we do. Of course, the Yadkin flows through the heart of North Carolina and provides drinking water for more than 1 million North Carolinians. It is just right out here about 10 more miles, but we call it the hidden river because nobody sees it except when they're going over it on the interstate. So talk a little bit about what we do, what river keepers do. Obviously, the animal feeding CAPO issues are big for us as well. And talk a little bit about our diversity and equity and inclusion efforts as a predominantly white organization. As Carrie said, we don't look like some of the communities that we're trying to help. And so we're trying to address that by doing some things internally within our organization that will help us do that and be in that position to build those relationships, because we just can't go in and we're going to save this community because there's an environmental problem. We know it doesn't work that way. At least we're learning it doesn't work that way. And so just briefly, we are a membership organization. We have about 400 members. That should be more like 1,000. So everybody in here join up. We really need the support and resources to work in a 7,200 square mile watershed. We have 3 full-time staff and 3 part-time staff. We have about 18 board members, and that's a significant increase for us. And we're really hoping to engage those board members to do more work. We get our funding from a variety of sources, including the foundation for which the library is named, the Z. Smith Reynolds Foundation and the Winston-Salem Foundation, among others. And we are, first and foremost, an environmental advocacy organization. And we are affiliated with the International Waterkeeper Alliance. So you might ask yourself, what do river keepers do? Or you might not. You might know. But it is the name of our organization, but it's also a person who keeps their eyes and ears on what's going on the river, advocating for better water quality. We sampling and monitoring. We try to stay on top of threats to the river and document those threats, and just generally try to increase people's awareness about the importance of the river to both our economy and the environment. And we do like to get out and have fun on the river. It's important to take people out on the river so they know it's there and they see its beauty and understand its importance. As I said, we have been on a DEI. I know the acronyms are getting a lot of flack these days, and so we do try to actually understand what these words mean, and we're constantly trying to define what they mean for our work and what we do. And we were fortunate with one of our Z. Smith Reynolds grants to be able to put together a diversity plan, which is primarily focused on organizational diversity. But once again, we wanted to go beyond that. What can we do to help these communities? And so in the following year, we received a grant from the Winston-Salem Foundation to hire what we call a diversity communication specialist, and that position is now involved to what we call an environmental justice advocate. We also got racial equity training for our board and staff, and so 100% of our staff has been through different levels of racial equity training, and we are encouraging many of our new board members. We've almost had a complete turnover in our board. And so those are important things to make sure we understand the struggle that we're dealing with here. And then some limited educational program. This is a group of students organized by one of our board members, who's a professor at Winston-Salem State, to get them out on the water at Salem Lake. We have just recently, through a board retreat, revisited our diversity plan, and we're trying to expand it. And Waterkeeper Alliance, our national affiliate, they are requiring all people that have the word keeper in their name, that they license Riverkeeper, Waterkeeper, Baykeeper, to actually expand this DEI work to also include the J, the justice. So it's that catchy little acronym, JEDI. Sorry, not so catchy, J, but yeah, that's an important thing for us to make sure that we are, moving in a direction that's more than just, well, we have X% of members of our board are people of color. But we have done good in that department. We are, like I said, working on these internal actions, but really when we're trying to get out in the communities, that's where we have to build those relationships, to be able to have those partnerships and be able to assist them in a meaningful way. One way we're trying to do that is through an environmental justice mapping project. And two of our staff are here tonight, Bailey Hill, our environmental justice advocate, and Grace Fuchs, our Riverkeeper assistant. And they were fortunate enough to be awarded a Spatial Justice Studio Fellowship earlier this year to do an environmental justice map, to look at where are the communities of color in our watershed. And here's a map that is just a work in progress. That the gray shaded area is the watershed in the state of North Carolina. And I think this particular map, just for hypothetical purposes, I believe that the yellow dots are brownfield sites, former industrial sites. We have a lot of those legacy issues, legacy pollution issues. And so trying to connect those dots between where these communities are and where we are in terms of them having these disproportionate impacts on their lives that we've heard about already today. So the goal of this is just to give people a picture as 1,000 words. And so I want to talk just briefly about two specific communities that we have worked with over the years, one over a longer period of time in West Baden, and the second one here in Winston-Salem more recently. And let me just preface that by saying that, we can't speak for these communities. We want to elevate their voices and help them get the resources. Once again, many of these communities don't have the resources to evaluate that 1,000-page document that Alcoa files. So, it's really hard to kind of strike that balance, because we want to help, but we want to do what the community wants us to do. And so in this case, you can see an aerial view. This is, I guess, a screenshot from the map, the story map. So that shows the location of Alcoa's smelter plant in Baden. Couldn't have it at a worse spot, right beside the lake. And there's the river. And we've got this fancy printer, the river, the Baden smelter there. They produced aluminum from about 1920 until 2007 when they shuttered the plant. So it's not really producing anything now. And Mr. Macy Henson, the other opportunity we'll have in this map is to tell the stories of the members of the community. He worked at the plant. He dumped hazardous waste in the landfill, but at the time was not considered hazardous waste. So these people are telling their stories about what they did, their genuine experiences, what they know is buried in the landfill. And Macy is the president of the citizen groups we're working with there, Concerned Citizens for West Baden. And they also work with the North Carolina Environmental Justice Network. So hopefully we're getting the right mix of people in them. This is just an aerial shot of the plant from one of our flyovers. We do aerial surveillance 3 or 4 times a year. And I won't go into all the details about the various permits that the state issues and works on with this, but to suffice it to say, most of this area here that's been scraped and cleaned. Now that they removed 2,000 tons of soil last year because they were having runoff containing fluoride and cyanide going into Little Mountain Creek. So a lot of activity there. Alcoa is playing the run out the clock game. We'll all be gone by the time they finally decide to clean it up. But it is an environmental justice community, in our opinion. But through some of our research, we found some very interesting aspects. This is just a quick shot. All the blue dots are the disposal areas where Alcoa disposed of waste over a period of 100 years. Some are worse than others, like the Alcoa Basin landfill, which is currently under assessment by the state and EPA. The on-site landfill here, and then the small brick landfill over here is a slightly different facility. But this is the community of West Baden. As you can see, all those spots are right there on the historically segregated. This community was built as a community for African-American workers back in the early 1900s. And they got jobs, they got healthcare, but they also got poison. And they're still getting poison, we believe, from the landfill here, where Alcoa buried what at the time was not considered hazardous waste, but today it is. And we think, because it's an unlined landfill, that it's pretty simple, just clean it up. And that's what the community is. This is an aerial shot, another aerial shot. This is the landfill. Again, it looks nice. I can play some ball on that. But this is the community of West Baden, still right beside of this. And once again, they cleaned up some areas around the site, but we're still seeing dozens of violations of water quality standards on a regular basis. We organized a citizen hearing. As many of you know, the state has public hearings, but those are really formal. There's no exchange of information. So this was our opportunity with our colleagues from the Southern Environmental Law Center. And some of you may know Mike Longest from the Duke Environmental Law Policy Clinic. So great turnout for that. A lot of community members were there. I can't really see many of them, but I look particularly upset about something. I'm not sure. But just clean it up, I thought. With the little research that Bailey and others have done relative to an environmental justice report, North Carolina now has an environmental justice report that they file for every permit action, every major permit action. And what we found here is that, oops, go back all right. Play the punchline first. But that small blue circle area, that is the community where the smelter is located. But what the state is doing is they're using these large geographic areas like zip codes or counties or census tracts to measure the demographics of a particular area. And so the state has decided that this is not an environmental justice community. They're saying West Baden is not an environmental justice community. And we find that hard to believe, because if you look at census blocks versus census tracts, you can see obviously that that area is 60 to 80% African American. And that's West Baden, right beside the plant site here. But if you do it by census tract, of course, the rest of Stanley County is white. And so that gets completely diluted. And so the state has concluded that this is not an EJ community, which of course we have challenged, and we have written them a long list of comments, because not only is there this matter, but there's also the matter of them not engaging the community, not asking the community what they want, how they can participate. And we are really pushing them on that, because this site really should have probably put under Superfund, right, Sam? No comment. All right, so just to wrap up with the local example here, you may have read about this in the paper. The Smith Reynolds Airport is trying to expand, but they only have a very limited area to do that in. In 2015, they clear cut a large tract over 200 acres. And shortly thereafter, not surprisingly, the neighbors on the other side of that creek began seeing severe erosion and increased runoff coming off of the airport. And, the airport's still saying it's not their problem, but I think you can see from these pictures, and in their defense, some pictures were taken much later, just this past year, because the trees were getting ready to fall into the creek and potentially hit someone's house, they just went in and cut them down and just left them on the ground. So this is a real mess. They were supposed to get an Army Corps of Engineer permit back in 2019, and they didn't get that, but they just continued on their merry way to do whatever they wanted to do. And they've had notice of violations for construction stormwater permits. It's a very confusing mix of who's on first and who's on second in terms of who's supposed to be regulating the site. And then on top of all that, several members of the Forsyth County House delegation have introduced a bill to de-annex the airport from the city, even though it is in the middle of the city, which a lot of us feel like is an environmental justice issue, because the city then loses some degree of control. And I understand the whole thing about you don't want to pay taxes twice. But just a real quick wrap up here. This is one of the homes that's been damaged, and you can see that little building's about ready to fall in. I think it may have been moved back already once from where the creek's eroding. And so once again, this neighborhood and what we're finding out through some partnerships, working with Neighbors for Better Neighborhoods and their resident leaders, the scope of this problem is probably a lot worse. And we're trying to work with a coalition of those residential groups to try to get the county, particularly because they own the airport, to address this problem. And they have applied for a grant to do stream restoration, but that'll just be a little drop in the bucket to fix this problem. So that'll do it for me for now. All right, thank you.
The last but not least, we have a presentation by Crystal Dixon on medical waste. Environmental recovery focused on North Carolina as a whole, specific location in river, Yaqui River areas, and we're moving presentation. Focusing on the effects of exposure to medical waste as an environmental issue.
Wow, I'm inspired. I really am. I see some familiar faces in the audience as well. Stan, Dr. Shea, Roe, a few friends. I see some students too. I remember your faces, believe it or not. So thank you all for coming out. So my notes would not print, so we're gonna make it. But the good thing is I know most of the stuff. All right, real quick, here's some objectives just so you know. We're gonna quickly talk about waste and various types, how to identify medical waste. So we're gonna shift the gears a little bit, but Edgar had a great segue into talking about landfill in terms of medical waste and impacts on health. So does this look familiar? Where is that? Beautiful Wake Forest, right? And so who was here during the Weaver Plant Fire? Okay, so you remember that. It was chaotic, right? It was like, oh my God, your parents were stressing out, get my kid off of campus. What are you doing, Wake Forest? Shut down. Classes were canceled. Students were moved to hotels. Some students jumped on planes to go to the Bahamas. I heard jets. You know, say where I got that from, right? They drove homes, right, to their parents. They were removed from the poor air quality. We cannot have our students exposed to ammonium nitrate. That is inhumane. So why don't we have the same response to our Black and Brown communities, right? You all are a great model. We were a fantastic model, what it looks like to be equitable. Right. And so what is environmental racism? Well, it's when your communities of color are disproportionately burdened with the very things that our presenters just discussed. All of those policies and practices are when they live proximity to source of toxic waste. Right. So if you look at this model here, or this graph rather, you can see that Latinx communities, particularly in Black communities, of course, are 60% more likely to be exposed to pollution than they produce. So the very people who are not consuming are more affected by the pollution that's created by by white people in this case. Here's another more up-to-date graph. It discusses how Black and Hispanics in the US are exposed to higher levels of pollution again, yet they consume less of goods and services. So how is it that you are not consuming as much, but you're getting more disproportionately affected by the effects of those services? That's an injustice, right? Here's another thing. So of course, when you hear that information, you're like, oh my goodness, 1 in 3 people are concerned about the air pollution, particularly Black people, extremely concerned about the air in the environment and what they're breathing. So your zip code, I often tell my students, is a bigger predictor of your health outcome than your genetic code. You probably have heard that before. Here in North Carolina, if you go from one county to the next, there's a 10-year gap in life expectancy based on where you live, right? Also, as was mentioned earlier, Ms. Carey was talking about educational resources and access to those things, all determined on where you live, right? So toxic waste and race, which was introduced to me actually one of my classes when I took a Dr. Stan Myberg, was talking about one of the earliest reports that actually discovered that race was the biggest and single biggest predictor of location as related to landfills. So where you live directly and who you are directly depends on whether a landfill is put in your area, which is what we just discussed in our previous presentation. In addition to that, it's important to know that 1,600 facilities incinerate medical waste. So on top of the landfill, there are also medical facilities that are actually incinerators. So what's important to know is that communities of color are obviously mostly burdened by that, and they've been fighting for decades to fight against waste being put in their backyards, literally for decades. And they recognize that healthcare industry is also contributing to this. So how is it that the very healthcare industry that's treating you are contributing to the inequities? Think about that, right? That's pretty significant. All right, so obviously Carolina Activists for Climate Health and Equity is a newly formed group, which I'm a part of, and we're going to talk about the event they're having, but they've discovered, they're talking about that 8.5% of climate and air pollution is caused by the healthcare sector. That's pretty significant, right? So if you're wondering, what is medical waste? There it is on the board for you to read, but essentially it's what you're generating during healthcare activities. There's so many kinds of medical waste, and here are a few for you to consider to look at. I won't go through all of them, but these are examples of medical waste, right? Most of medical waste are actually considered non-hazardous, where the very small fraction, 10 to 25%, is considered actually hazardous. So we're talking about what that actually means. So let's talk about the environmental justice concerns. Well, there's waste incinerators emit some of the most dangerous pollutants known to mankind. These are literally incinerators that are burning medical waste, such as ethylene oxide, which is getting a lot of press lately. We'll talk about that in a second. And when plastic is incinerated, it creates hazardous heavy metals. Mercury, lead, things that we don't want in our paint are actually going into our air and dioxins as well. So if you live within proximity of these incinerators, you're obviously exposed to them. All right, dioxins pose tremendous risk to communities, particularly frontline communities. So environmental justice also, if you don't know this, that 79% of municipal solid waste are placed in Black and brown communities. You just saw that. It is actually true, and which is linked to health disparities in our country. And lastly, according to the EPA, medical waste are the second largest source of dioxide emissions. So if you live near one of these, you may or may not be in a good situation, right? So this gets a little muddy because that's how Congress can be when it comes to things happening. But there was once upon a time where Medical Waste Tracking Act actually tracked medical waste. It was 2 years, and my friend Stan can correct me, but it was 2 years that they were actually tracking medical waste from cradle to grave. When they realized, oh, well, you're not really getting access to contaminated medical waste, really at the generational point, not really when it gets into the environment. When it gets to the landfill, it's not that contagious, but maybe at the front line with the workers, yes. But that had been expired, all right? So now the Resource Conservation and Recovery Act, or RCRA, gotta say that, they monitor hazardous waste. And all the other wastes are left to the state to actually determine how they want to regulate non-hazardous waste. Right, it's a lot saying that. My friend Denise Patel says it better. She says this law determines how waste gets managed at a high level and gives authority to the environmental EPA and the federal government to deal with hazardous waste. The federal government classifies what is considered hazardous waste. It's a lot of power to be able to do that, right? Some of my friends are arguing, well, there are other things that should be considered hazardous waste. We'll talk about that in a second. And anything non-hazardous is then managed at a state level. So just repeating what I just said, but I want you to understand what she's saying, because in her position, she's expertise in that particular space. But this is what RCRA does. Right? This is what it looks like. That's all their management, right? Now, ultimately, there is no federal regulation to track healthcare waste. So who lived through the pandemic? Everybody is here, right? Right. So we're wondering, what is the impact of all of that medical waste on the environment? That was a question that was posed by my friends Brenda and Megan, which you probably saw at the last RIPI event. And they wrote to several people in Congress about that concern. They asked, well, what's the role that DEQ plays? What's the role that RCRA plays? What's the role that EPA plays? He wants to know who are the players and who's in charge of this, because I'm concerned that a lot of this medical waste is being dumped into my backyard. This is a question. They said it's the wild, wild west. They don't know. I don't know. It's great. We did it for 2 years, but I don't really know. We've actually never done it during the pandemic. So we actually passed a policy, the American Public Health Association. At the time, I currently am the governing council of the American Public Health Association of the environment section, but we passed it just to call for an oversight to see, is it affecting the communities? Because we know landfills are disproportionately in Black and brown communities. If you're dumping medical waste in Black and brown communities, what's the effect on our health? It was just a question. So you may have heard of Stericycle. This is one of the largest medical waste, probably the largest actually, federal medical waste incinerator company in the country. They've been getting a lot of issues. $40,000 of civil penalties been pulled against them. Now, the irony of this is that they're actually sterilizing the very waste that we're wondering about. So ethylene oxide is what they're really been under the press about releasing during, this is just one of them. There's a lot of companies that are under the press about this, but they're wondering who is affected by ethylene oxide. This is a colorless gas. And you can imagine who it might be. This is a zoom in of what this is. This is actually in Charlotte. This is a location of one of them. While it's actually considered a commercial sterilizer, it's not necessarily considered, EPA has not identified it as elevated cancer risk as of yet, but as you can see, 39.7% of people are people of color and 38% are low income. They're exposed to that actual ethylene oxide. So right now, my friends at the Unions of Concerned Scientists are trying to make a big deal about that. What's going on? Can we raise awareness about that? You all are closing your eyes. Can we please look at it closer? This is an environmental justice issue because you can't even see it, right? You can't even see it. So what can you do to advocate? Here are a few things on the board. I won't list them out to you, but here's something you can consider. And right now, if you didn't really know, and I'll certainly share my slide if you're interested, HHS reopens the health sector climate pledge. Back in the day, I think it was April 22nd last year, they opened it. And then they closed it in October because, I guess they figured they needed to close it. They reopened it because they realized, wait a minute, the healthcare sector has a big role in addressing climate change. So they reopened it. And what it's simply asking healthcare people to do, because our World Bank has identified that low carbon strategies start with healthcare in many ways. This is what they're asking a lot of healthcare companies to commit to. All right, reducing organizations' emissions, things of that nature. Because we recognize that how is it that you're affecting the emissions you're putting into the environment are actually creating sicknesses in those people that you're serving. There's some accountability that has to be there. Good news is we have a lot of hospitals that are actually jumping on board. Last few slides here, I'll just say here are a few examples you could do to address that. I won't go into those specifics, but I will highlight reprocessing single-use medical devices with third-party reprocessors. It's becoming more popular. It's actually cheaper. It is a discounted way to actually save money and to also decrease in the waste. I'm encouraged because these two new entities have recently formed and they've been coming out and showing their support of the issue here in terms of medical waste. And I'll end with this. We're having a symposium. If you're interested, it is free. It's online this Friday to learn more about sustainability in hospitals. This is through CASH, or Carolina Advocates for Climate, Health, and Italy. So I'll stop there. If you have any questions, let me know. Thank you so much.
Thank you, Professor Dixon. So I did want to have some time for Q&A, but to be honest with you, I told you we'd be here for an hour. So what I would like to do is again, thank our speakers. Thank you, Professor Dixon. Thank you so much, Carrie Wiggins. Thank you, Stephen Sills. Thank you so much. Ken Riverkeeper, Edgar Miller. It's a true pleasure. And I have to add, Wake, it's always a true pleasure to see Wake alone from some panels. And so this concludes the first event that we have, in the only event for the speak for this spring here for RIPI. But we hope that you will join us next week for a Wake Speaks event to take place virtually on April 25th and April 26th. Wake Downtown, excuse me. Wake Speaks event put on by the Communications Department on April 25th and April 26th, where students from the Community Narratives of Environmental Justice course will carry out presentations on their respective projects. You can find flyers for the event in right outside of this room. And I encourage you now to join us for a reception and to walk around and look at student poster presentations. And please feel free to come up to our speakers if they have any questions. Yes.
One quick thing that reminded me, the project that Bailey and Drake are working on. You'll be having the environmental summit. Is that going to be the size of it Friday, June 9th or the 10th? Still working on it. TDB. So stay tuned for that to basically release the map and, have a panel discussion around that. We'll also be doing a reading of the smell of money, which is about the Hog Cape Ocean, at the aperture on the, I believe that's the 8th at 7. Okay, great, thank you.
Thank you. And be on the lookout for the recording of this event on the RIPI website, ripi.wfu.edu. Thank you all very much and join us outside.